morning! And today gagawin na namin yung oral surgery for Liam. So if nakita nyo yung mga previous episodes namin, nagpupunta kami medyo quite frequently sa dentist because we're trying to nagpupunta kami medyo quite frequently sa dentist because we're trying to fix yung extra tooth dun sa front tooth niya. So may maling tubo and as soon as possible kailangan talaga siya matanggal doon kasi 3 years na siyang sumisilip pero hindi talaga siya lumalabas. Kaya na-impede na yung pag-erupt nung permanent tooth niya. So today papunta kami sa Greenbelt branch ng GAOC. So napunta kami sa Greenbelt today, normally sa BGC kasi yung kanila daw surgical suite ay nandito. Tapos especially for kids, for pedia cases, they prefer na dito talaga gawin. So nandito siya sa ground floor ng Greenbelt at Residences. And very quickly lang, bakit ba kami napunta ng GAOC? Actually medyo premium yung pricing compared siguro no sa ibang mga dentista, pero at the height of COVID sobrang natakot kami na pumunta sa mga dentist na hindi namin kilala. And dito very safe, makita talaga namin that they are observing proper protocols. And Liam kasi as a backstory, nagkaroon siya ng case before of myocarditis. So it's caused by a virus even before COVID. So medyo critical yung exposure. Ayaw namin na ma-expose talaga siya sa mga ganong virus. Ayan, sorry. So meron lang nag-check na guard. So ayun no, if meron kayo mga ganyang cases with your son or daughter, yung dental din kasi is very critical. So, minsan kala natin sumakit lang yung ngipin, pero directly connected yan sa ano natin, sa brain. So dahil very particular kami sa health ni Liam, it's something that we really want to be sure of, something that we want to save money on kasi forever yun forever yung ngipin, no, hanggang lumaki siya. And of course, yung health niya talaga binavalue namin ni Daddy. So later, makita nyo kung ano siguro yung mga iba pa namin gagawin. But ngayon, Liam, how are you? Hello! Yan, I think he's feeling a little bit nervous, which is, syempre, diba, normal naman yun. Kahit ako nung nag-oral surgery ako dati, kinabahan ako. But he's really doing a good job for trying to be brave. So, yan, see you and share namin mamaya kung ano yung meron dun sa surgical suite ng GAOC Greenbelt. So, nandito na kami ni Liam and actually we were just informed that ayun, nandun yung mga staff nila sa kanilang testing area because today is a Monday and pag Monday daw nila ginagawa yung kanilang COVID testing to make sure that good morning, Doktora!
Was he able to do the plastic naman po?
Yes, apo.
Just be prepared.
Alright, thank you po. I am hungry. I am hungry. Hindi? He's hungry na daw. Kasi Liam is on fasting. No water, no anything by mouth for the last 8 hours. And yun nga, no? So going back to what I was saying kanina, every Monday pala, they conduct their COVID testing. Okay? So, kanina nabanggit ko na feel namin yung safety protocols nila. Ngayon, no, first time namin na ganito kaaga. And ngayon ko na-witness na ganoon talaga. No? Yung lahat ng staff nila, nandun sa testing room. And then, they do it every Monday. Kapag mayroong mag-positive, ang gagawin daw nila is uwi agad. They will have to sanitize the whole area and hindi sila makakapasok dun sa mismong treatment area, which is right there. So, nandun yung testing area, and then dito yung treatment area pa beyond that glass door. So, definitely, hindi na sila makakapasok dyan if meron man mag-positive. So,
I will just take a nap.
yes, you will just take a nap and then it will all
For
be
me, it will
finished.
be 1 second.
Because you're sleeping.
Because 8 hours for sleeping is 10 minutes for me.
10 minutes only?
It will only be like 1 minute or 1 second.
Brave boy, brave boy. So, yun, no? So, I think it's going to be a successful one. And we offered our prayers already last night. Liam will be brave and the doctors will be granted with a clear mind, bright eyes, and what else? At pa pinag-pray natin na maging successful yung aming oral surgery today. So, yan. Later on, pakita namin
Surgery
sa
at
loob.
this age.
They're having surgery at this age. Yeah. Kasi iba yung case talaga ng ngipin mo eh. So,
Because of your family line.
maybe it's genetics. No, daddy has extra tooth, mommy has big teeth. So, halo-halo. And sometimes it just happens. Diba? So, but it's a good thing that at this time and age, we have very high technology, high-tech devices, diba? Na makakapag-help in improving
There were no
your
sedatives
condition.
back then?
Meron, pero dati, kahit ano itsura ng ngipin mo, okay lang. Bala na yan, kahit anong tubo. Ngayon, they're very particular. They conduct CT scans para mas accurate, no? Especially yung case niya, tinitignan nila kung walang mga delikadong nerves na tatamaan. Kasi nga, overlapping yung extra tooth and yung permanent tooth. So, you're very lucky, anak, kasi ngayon, high-tech na. Sure na sila sa gagawin nila. Even
Was there
before...
anesthesia before?
Oo naman. Yes naman. But, even ngayon, yung dental clinics, very sophisticated, diba? If you look at the
What if I wake
area.
up in the middle of the surgery?
If you're sedated, you won't, anak. They already know the right dosage for you so you don't wake up in the middle of the procedure. Yan. So,
They calculate.
dami po niyang tanong because it's normal, diba? Dahil hindi nila alam kung ano yung mangyayari. So, if you have a lot of questions, you can also send in your comments and we'll be gladly replying, no? Kasi gusto rin namin makahelp sa mga parents na hindi alam kung anong gagawin nila. Kasi for a time, we're at a loss on what to do, no? 3 years actually na inaantay namin yung ngipin na yun. And it was November last year when we found out na kailangan pala ng more serious interventions. Which ngayon lang namin talaga nagawa because we waited pa for additional 6 months. And may mga tests na ginawa sila, doktora. So, we want to, thank Dr. Keslin of GAOC BGC. She's here today. She went here in Makati for Liam, no? She's the head dentist in BGC, but she went here in Makati to make sure that Liam is comfortable. And later, mamimit din namin yung surgeon ni Liam. I think, Dr. Cabasa, if I remember the name right. And of course, to the whole staff of GAOC for always making us feel secured and safe from day one. Yan. So, ako naman yung nandito ngayon sa testing room. Okay na lahat ng kanilang mga staff. And since I will be with Liam and last week pa yung antigen ko with them, I will have another antigen today because I want to be with Liam, of course, in the surgical suite. So, basically, this is how the antigen room looks like. Similar to what they have in BGC. So, meron silang separate area for testing so that, yun nga, before you go to the treatment area, sure sila that you're not positive. Kasi nga, iba na yung panahon natin ngayon, diba? So, COVID is still there. Although medyo maganda na yung number of cases, pero compared to like 2 years ago, pero syempre, we have to be very, very sure. Lalo na we'll go to a certain procedure today. So, yan. Ano nila yan? Protocol nila yan dito kay GAOC pag magti-treatment ka antigen for good for 5 days yon. Si Liam actually went through RT-PCR kasi so siya mag-open talaga ng mouth mamaya. Nag-RT-PCR siya last Saturday. Ginawa namin. We got it yesterday and thank God negative. So, ako na lang today as a companion. So, yan. This is their resting area. Alright. Ayan. So, right now, it's 9:40. So, you were scheduled at 9. You were here at 8:30 for yung mga, pre-procedures. And, nandito ko ngayon sa waiting area because dun sa surgical suite, ang pwede lang si Liam and yung set of doctors that he has, no? So, medyo nagulat ako because that's a team of doctors, there's an anesthesia team, and then na-meet ko na rin si Dr. Cabasa. So, she's very kind. Of course, Dr. Keslin is there to be with Liam and to support him also, no? But basically, the explanation was, I think, pretty common kasi a few days ago daw, Dr. Cabasa performed the same procedure sa 7 years old naman. So, medyo mas complex daw yon kasi nakatago talaga yung ngipin. In the case of Liam, medyo nakapeak yung ngipin. So, hopefully, it will not be as difficult. But, just the same, they still don't want to underestimate everything, no, until the procedure is finished. So, basically, nandun lang ako before sedation when they administered the sedative, and then right after that, I was transferred here in the waiting area. So, sabi nila, there will be a 30-minute to 1-hour recovery also after the procedure. Liam will feel a little bit of nauseous and sabi ni doktora, little bit of nauseous, tapos medyo hindi pa siya ganun ka-aware. So, we have to go home immediately after this because it's gonna wear off after 6 hours pa. So, practically, he'll be napping lang daw the whole day. So, I'm here and hopefully maging okay naman lahat. So, in the waiting room naman, you will still feel taken care of kasi, ayan, so you have everything that you need. May water, there's Netflix, so you have an option. And dito sa room na to, ako lang nagsistay. So, it's not shared. Again, part of the safety protocol, mag-isa lang dito, no? Per patient siya. So, really dito namin nakikita that it's a very good health investment. Despite na medyo mataas yung pricing, but we get the feeling of safety and protection here in GAOC. So, ayun, later, maybe, pwede natin masilip si Liam when everything is finished. But for now, we'll wait for the doctor's go signal for me to go back in the surgical suite. So, see you ulit mamaya. Yan, so it's 9:50 and somebody went in to tell me that they are already suturing Liam. So, closing na. Thank God. Mabilis lang yung procedure. I wasn't expecting it will be that fast. Pero, siguro katulad nga ng sinabi ni Dr. Cabasa, mukhang hindi naman complex yung case. So, very, very thankful. Kasi, kinakabahan talaga ako. I mean, for those who know me, alam niyo siguro kung gaano ako ka-worried, no, about the situation. But, lahat ng mommies, no, ma-worry tayo kapag yung kids natin undergo any medical procedure. So, but I'm happy. They say na nagsusuture na sila. So, maybe in a very short while, punta na kami sa yung recovery time na ni Liam. So, that fast lang. Yan. So, sige, wait tayo ng further updates on Liam. Lang naman. Yay! So, here's Liam. It's finished na. Finished na. How are you? Oh, good? Not good? Feeling dizzy pa. Feeling dizzy. Okay, that is okay. Ayan, natapos na kami. Very fast lang actually. They just did not rush the recovery period. Pero mabilis lang yung procedure. Thank you to the wonderful team of GAOC Greenbelt. Headed by Dr. Cabasa, of course, Dr. Evangelista, and our anesthesiologists, GAOC, Dr. Almoro, Dr. Te, and Dr. Iris. And to all the very helpful staff of GAOC, thank you for the successful oral surgery of Liam. And then we'll go back to GAOC BGC on Friday for another checkup. So ayan, advised to go on bed rest si Liam, and I will bring him home so that naka-rest na siya properly.